Hi, I'm Heather Dawn of bodynews.com, and we're going to do some work here for a herniated disc. We're interested in creating strength in the back, so we're interested in more flexions. Forward folds, extensions can cause problems with herniated discs, putting pressure on the spinal cord, which won't feel so great. So you want to focus on flexion, strengthening the back, opening up the hips, opening up the hamstrings, and strengthening the core. Here are a few moves that may help you. Start out in Shavasana. So lying down and put some support under the knees so the weight of the legs isn't pulling on the back. Even the most subtle moves can be bothersome when you're dealing with spinal injuries such as herniated discs. So just a few breaths here, and make sure as you're breathing that you're scanning the body and going through muscle by muscle from the crown of the head to the soles of the feet and just connecting with it, like eyebrows relax, jaw soften, belly expand on the inhale, relax the tummy, release the lower back, all the way down to the toes. Just a little bit of self-dialogue to bring you more in touch with the body. After you're done with that Shavasana, which can be 10 to 20 breaths, you'll walk the feet in for bridge preparation. From here, palm the floor, inhale, lift the hips, strengthening the back of that body, and then exhale, gently lower down. And you'll do this a few times. Inhale, lift, strengthening the back of that body, and then exhale, lower down. And of course, you're also opening up the front body. If you overutilize your glutes too much at the top, I would say place a block there. Blocks are also really great for strengthening the inner thigh muscles, which again will take some of the work out of the rest of the leg and put it into the inner thigh. So inhale, lift, and you can take the toes off the floor to fire up the hamstrings, and then exhale, lower down. I would say do 5 to 10 reps. Hold at the top, take your time. This is not about rushing through these exercises. Good. After that, we'll get into a little bit of a hip opener. Place your right ankle on top of the left thigh and firmly push the ankle into the left thigh. Keep the foot flexed. After a few breaths, you may want to raise the legs and thread the hand between that open space, between two legs, interlacing and relaxing. You'll get even deeper. You want to make sure that the tush isn't lifting up to get this clasp, or that our head, neck, and shoulders suddenly become stressed. If that's the case, you can use a block or blanket to help make sure there's no stress through that upper body. Also, straps, right? You can use your strap and just draw in. Okay. The idea is to get the hip open, not to add tension to other areas. You'll do both sides, anywhere from 5 to 10, and if you're feeling it, 20 breaths, it's totally fine. Just take breaths and get into that hip. Beautiful. Once we're done with that, you're going to hook the foot, extend the leg, and we'll get into a hamstring stretch. For most of my low back peeps, you're probably going to want to leave that other leg bent, but if it feels okay and you want to extend it, that's fine too. Feel free to test out those waters. Drive the foot into a deep dorsiflex position. Breathe. That'll also take the stretch into the calf, not just the hamstring. Drive the femur bone deep into the hip socket and gently draw the leg towards you. Make sure when you're stretching this hamstring, you're feeling it in the meat of the muscles, not where the muscles attach behind the knee or right around the buttocks. If that's the case, soften the leg a little bit. 5, 10, 15, 20 breaths. You'll decide. Once again though, make sure no head tension, neck tension, so adjust accordingly. Please do both sides. Beautiful. So now that we've stretched the hamstrings and the hips, we've applied a little strength through the lower back and opened the front of the body, you're ready to roll over to the tummy. Stack the hands in crocodile here. Rest the forehead, take some deep belly breaths. Good. After that, Bring the forearms to the floor, curl the toes into the floor, slide the knees forward, gently lift the belly off the floor, and raise the lower legs. If that's too much, leave the knees down, draw the abdominals in, strengthen the belly. Release, walk the hands back until the palms are even with your breastbone. Lift up, cobra. Strengthening that back. If it feels comfortable for you, you can also raise the legs. But again, let your breath determine. You should never be in a place where you're, that's a key sign you're not okay. Strengthening. For some of you, up dog may feel nice, but you'll have to experiment with that. You may need to do that on a chair or even this couch here. Furniture is really helpful as long as it's secured. Furniture that moves, ixnay, not okay. Beautiful. Then come to all fours and we'll do a few spinal balance here. So you're in this nice tabletop position. Extend the left leg and the right arm. Once again, strengthening the back and the core and all the stabilizers here. 5, 10, 20 breaths, and you'll switch sides. Make sure you're creating stability. We don't want to get into the wobbles there. Try these few exercises, start small, see if it helps. Yoga for herniated discs.